best stretches for knee pain. We're probably going to run into the same issues that we saw with our best stretches for low back pain, but let's give it a shot. Can stretches relieve knee pain?
Yes, they can.
Okay, that's a good start. That, I think we talked about this last time. I had a kid that called me and said, "Yeah, I kind of messed up my knee. He's a high school lacrosse player. He had a meniscus tear that had to get repaired. Well, had to get repaired. It got repaired, and he was doing great. And then he works at a car dealership, and he got in and out of a car in an awkward position, and his knee kind of swelled up on him, and he didn't feel good. And he said, "Hey, what should I do?" So let's take that situation. What would you tell that person that just called you and said, "Hey, what should I do?"
In that situation, it's either you're coming to see me. If you're not coming to see me, go see your doctor, like go see your surgeon. Which in that case, the surgeon is also probably going to send you to physical therapy. So probably go see your physical therapist on that one.
Okay, not a great example. Let's say someone's, my knee's kind of stiff. I've had, knee discomfort on and off. I was a little bit more active this weekend. I was on uneven surfaces in my lawn, raking up some leaves. That's the time of year. And my knee is kind of stiff. It's not killing me. I'm not going to go to the doctor or anything, but is there any stretches I can do to try to help out that knee pain?
So to me, stretching the knee comes down to most likely about three different stretches, right? You're probably gonna do some type of hamstring stretch, which people would typically know, like if you're seated in a chair or just like bending over to touch the toes. It would be like a kneeling quad stretch, kind of coming down, one knee's down, one leg's out in front of you, and you're putting the back foot up on something to stretch out, like now the front of the leg, the quad, and or then like stretching out you what's called like a standing gastroc stretch. So basically stretching your calf out, like standing one leg back and just feeling like that stretch into the calf. So there are more muscles that cross the knee, but let's, for simplicity's sake, those are the big three that cross: two behind, one in front, right? That's probably going to cover the bases. Like if any of those is going to do it, like those are going to be the three probably.
Okay, and if you have a shortening of those muscles, what are some mechanical problems or even like some symptoms that people might complain of that would tell them that they need to stretch those groups out?
I think that's so you know what I would actually want to see, like, can somebody do a squat, right? That's almost probably the easiest way to look at it. And it's like, well, you should be able to just go feet flat on the ground, squat on down. So like your butt's almost touching the floor. Like that's really the easiest way to think about it. Now, could there be some joint restrictions? Yes, joint restrictions aside, then too, right? It's like what's happening is that one of those muscles is probably tight. So if you're feeling that and it feels like it's really tight, even like in your calves or your ankles, well, that's probably it. Um, if it's not that, right, it's hard to say. Can you just bend your knee up? Excuse me, bend your leg up and touch your heel to your butt. If you can do that, good. If you can't do that, you need to stretch out your quads. Uh, and then most likely, like if you can't just touch your toes, you should probably or touch the floor actually with your knees straight. You'd probably need to stretch the hamstrings. This is
Okay.
maybe the easiest ways to look at that.
All right, so we talked about hamstrings and quads, those are the big muscle groups in the thigh. Is calf length important for knee issues?
Yes, and that's what we're saying. Like the calf goes actually up above the knee to where it attaches. So most people understand like the Achilles tendon, right? And that attaches into the calf. So that goes below the ankle joint. But the calf, the gastrocnemius muscle part of the calf, right? There's multiple parts, but that part of it actually goes up above the knee and crosses like with the hamstring along the backside of the knee. So yeah, that's kind of an overlooked one because everybody looks like the upper part of the leg, but not always the lower part of the leg.
Okay, and one of the main diagnoses that we see with knees is just general osteoarthritis. This is typically people that are 55 and older, sometimes younger, depending on their injury history. What would be the most important stretches for people that either want to prevent that kind of problem as they get older, or if people have been diagnosed with osteoarthritis, maybe they're even on medication at this point from their doctor, to treat that? What are stretches? I mean, we've kind of talked about the stretches that are there, but let's talk more about getting people invested in doing the stretches. What are the positive effects of stretching out those muscles on someone who has osteoarthritis?
I mean, Travis, if I just like take my hands here, right, and I just squeeze down on your knee as tight as I can with my hands, right? Now do that over every step you take. It's probably not going to feel great, right? And that's the same effect of like if your muscles are tight, they're bringing your joints too close together. They are not allowed to move through the motion that they're supposed to, right? You're probably not able to get what's called like the synovial fluid. So that's the joint lubrication. Like that's not able to get into the joint space as well, right? So just that alone, right? Like if those muscles are too tight, it's probably not allowing these proper things to happen. So yeah, you need to get stretching them out a bit.
Okay, let's talk about some basic standards. You did a little bit in terms of quad length. It's like, okay, if I can stand on one foot, even if I had to use something for balance, if I bend my heel up towards my hip, I should be able to kind of grab that with my other hand and then kind of get my heel pretty close to the backside of my hip. That might be one standard. Is there a standard for hamstring? Like in terms of how do I know if my hamstring is short? So like a test I could do at home. It'd be better to come into PT and do it. But how do I know when my hamstring is short and I would benefit from a longer hamstring that would require stretches?
Well, like I said, one that's you could just do a toe touch, like try and touch your toes, right? Like you should be able to easily touch the floor with your knees straight. But again, this comes a lot of different things into play. Another thing would be like a straight leg, right? So you can lay on your back, right? Let's use the right leg as the example. I'm going to keep my left leg straight on the table the whole time. I'm going to put my hands like interlocked behind the back of my right knee. And then I'm going to just try and straighten my leg out as much as I can. So when I put my hands interlocked behind there, my leg's pointing pretty much straight up, like that upper part of my leg. And ideally, you should be able to straighten your knee out. Now, technically, it's within about 20 degrees of full extension. I don't really like that. Like, you should be able to straighten your knee out. That's what should be considered normal. Not this, oh, well, 20 degrees, some places say 10 degrees. No, it should be straight. That's what's considered normal. So that leg just goes straight up into the air while you're laying your other leg straight down.
Okay, let's go back to your squat example just because we love that a
Yeah.
lot because it's a great expression of lower extremity range of motion. If we said, hey, the standard that we have, hey, toe straight ahead, heels on the ground, you should be able to get down into a full squat, meaning your heel should be pretty close to the backside of your hip. You should be able to kind of hang out there for at least a couple minutes. If you can't do that, is that definitely a muscle length issue, or could there be other restrictions that would make it difficult or impossible for you to assume that position?
That could very much be ankle, knee, pelvis, low back, mid back. Like there could be lots of other, also call it joint issues, right? So just different joint mobility issues outside of some of the soft tissue ones that we talked. And then some of it could just be that you're weak, right? And you actually can't stabilize through that entire range. You get to that certain point, and your body goes, whoa, 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 like hold on, hold on. I don't feel comfortable going further. I'm going to give you pain there because I think something bad's going to happen if we keep going.
And I heard recently, it was a surgeon that was talking about it, and it said everybody has like normal hamstring length. Like I
I
can tell you
agree
that
with that. Yes.
because when I put people under anesthesia, I can lift your leg right up off a table. You don't have short hamstrings. But if they get out of surgery, like, all right, let's stand, but just bend down and touch the floor, they can barely get past their knees. Like, what is going on there?
It's the body's protective mechanism, right? So your physical body is communicating with the nerves are communicating with the brain and communicating back and forth with the muscles there to say like, oh yeah, you can keep going or nope, that's it. We're not going to let you do that because if you do that, this is going to pop, this is going to tear, this is going to snap, whatever it is. But the body recognizes it and is processing it that quickly, right? So it's as you're going down, it might only take you 0.9 seconds to go down, whatever it is, right? It's like the body already knows, like, no, 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 it sent all the signals back and forth saying, nope, you're not safe to do that. We're not going any further.
And is that something like how would you treat that? Is that something where it's just kind of progressive load? It's like just practice that movement and get better at it. I know absent of severe pain, I mean, doing a deep squat, sustained deep squat is something that I will often give out to my patients. I'll tell them, I can hang out here for 10 minutes without too much of a problem, but this is something I've been working on for a while. So don't, you're not going to try this for 10 minutes when you go home today. So, in that kind of line of thinking, if we know that it's certainly better to be able to touch the floor than to barely get past your knees, what would be a protocol of stretching or movement that you would give somebody?
I think here's where we're going to come back to the it depends, right? So I really would need, so if you're saying like with the hamstring, like just being able to touch the floor there, right? Well, okay, what's unstable in that situation? Because that might not just be the knee, that could be going up to the back, that could be going up to the hip. Um, so assuming that it is the knee, now we're going to assume that if it's because you're going forward to touch there, it's probably, if it's along the back side of the knee, it's probably either the gastrocnemius, so like that calf portion that we were talking, or the hamstring, so like the upper part, back of the leg. So I'm going to do strengthening to those in some way, right? So it's probably going to look like some kind of bend pattern. So people have heard of like the deadlift. So it's basically like picking something up off the floor. And if you can pick something up off the floor now, okay, we can have you control that, like start getting a little further into that range of motion, maybe under that load that helps, let's say, turn those muscles on a little bit better, right? Get everything a little bit stronger. So that would almost be some of my starting point on that. And once you can kind of get that, like, okay, even just do a set of 5 or a set of 10, like picking something up. Now just retest it right after. Oh, you can bend down 2 inches further, right? Well, that's actually a pretty big change. And like you said, you didn't, you can't lengthen a muscle 2 inches just from doing 5 or 10 reps of something, right? This goes back to what the doctor was saying, right? It's like, okay, the range was already there, but now you've given your body that support and comfort to be able to complete that movement.
And in terms of basic prescription, in terms of, hey, I want to lengthen a muscle in my body, connective tissue, soft tissue, are you doing holds for like 10 or 15 seconds? Or what is the protocol that you would give somebody in terms of length of stretch hold?
So stretching time, minimum of 2 minutes. So it doesn't have to be 2 minutes once. It could be 2 minutes, excuse me, 1 minute 2 times, 30 seconds 4 times. Sometimes, and but now going to the 10 seconds, right? Sometimes you just actually do back that down and do, okay, hold this 10 seconds, come out of it, go back into it for 10 seconds, come back out of it. And we're just talking static stretching here because there are lots of different types of stretching that we could also get into, but it's like static stretching is just holding it, but maybe you just build that up. To that total time of 2 minutes. So if you're holding it for 10 seconds, okay, do 12 of those for 120 seconds. And now you've kind of built up that long enough time to have what's called a plastic effect. So think of stretching a rubber band and it always comes back versus think of stretching a plastic bag where once you stretch it, it actually just stays kind of stretched out. That's kind of the same effect that you're going for if you are stretching a muscle.
All right, that was our best shot at some advice and guidance on stretching. More flexibility isn't always better, but for the most part, in the patients that we see, more people are in need of better mobility than having excessive mobility. So yeah, make sure you're stretching to help out any knee pain issues. And if the stretching we gave you is not working, then best thing to do is have someone that knows what they're doing take a look at it so you can come in and see us. Right, Nick?
That's it. You got it.
All right.